Hi, Prasad.
Hi, Louis.
Very excited to be here with you for this conversation on design thinking. Without further ado, I think people are waiting for us to talk about design thinking and what it is. And before I ask you that question, I really wanted to understand from you, how was your journey in design thinking? When did everything started for you? When you decided to bring design thinking to Dr. Reddy's, when you incubated the Studio 5B 5 years ago. I would love to hear from you. What was your journey?
Firstly, I think I've always been a fan of design, not design thinking, but really design. Good design, I think, is something that intuitively appeals to me as a human being. So I used to follow the work of IDEO quite closely about how they, their process of design thinking and how design thinking has an influence, how they created an influence in design thinking. I'm also a fan of Apple for many years and see how they use design to really enhance the experience of the user. So I've had some familiarity with design and design thinking as I was growing up. And then, when one of my friends actually introduced me to IDEO's India office, and India was involved in doing a number of projects for other companies who had already embraced design thinking. And I had the opportunity to use IDEO for a couple of projects. One of them was really to brand Dr. Reddy's, to bring together the whole organization around one vision, one mission. And that's how our credo, our belief came into being. Good health can't wait. And one of our colleagues, Raju Kumravolu, actually led this project. And as this project was going on, I was learning the whole design process. I had theoretically understood what it was, but in practice, it was a bit of frustration for me, being an engineering kind of a mind, ration, logic, and multiple steps to hear words like empathy, putting yourself in the shoes of the audience or the user, and also how do you listen very actively and understand things. And these were a little alien to me, but when the whole process ended, and I was always told, be patient, keep the faith, let's go through the process. And this was always the pushback. And I was used to consultants telling me precisely where we were in each step of the process, but here it was much more fuzzy for me. But at the end of the process, I was very pleased with the quality of the work, the output and the intuition, the insights that we got, and how the whole brand architecture came together. So that was very inspiring for me. And then we did a couple of other projects, some of them which went live, some of them which haven't. And so, I learned design thinking through actually experience with IDEO. And that's how I got into design thinking. And I saw the power of design thinking in creating solutions to our customers, to our patients, to our partners, and also for our employees. How can we make things delightful for them? How can we simplify things? How can we enhance the experience of working with Dr. Reddy's or doing business with Dr. Reddy's? So in a way, I saw the power without being able to completely put words to it. I saw the power, and I, in faith, jumped into this. And the opportunity came when IDEO was leaving. Tim Brown, who was CEO at the time, told me, look, we've had conversations on design thinking, and this is what is happening. Would you like to hire a few of my colleagues? And that's how I got this initial team of Param, Tarun, and a few others, Ridhima, to start the studio. And initially we thought of starting it in Hyderabad, but we couldn't really get the right kind of people to move to Hyderabad. So then we moved the studio to Bombay. And that's how 5B started in Bombay. And that's how design thinking came into Dr. Reddy's. I still think that we're really just scratching the surface with the power of design thinking. There's a lot more we can do with design thinking, journey thinking, design by itself. So I'm excited. I'm very, very interested in seeing design thinking becoming a part of the mainstream of how we build our products, build our services, build our IT solutions. But it's not been a simple and easy journey. I mean, people have not embraced design thinking readily and for various reasons. And I still have to evangelize design thinking a little bit. And hopefully, this 3 months program that you put together will create the pull for design thinking, and people start using design thinking. Having a studio and doing work is good, but it can't be done at a full scale. To do it at scale, each of us have to understand the process and how it works, and bring that element of design thinking into our day-to-day work of designing processes, designing work, designing experiences, designing products, all of those.
Right. I mean, it's great, and I mean, we'll understand now when we keep talking about it that is a process that can be adapted by everyone. I think what is really unique about what you just described to me in your journey is that you were the pioneer in the pharmaceutical industry in setting up a design studio in the pharmaceutical setup.
Just let me interrupt you. I heard of Fresenius was one of the first to do this. And they actually simulated a hospital setting inside the studio and to understand what patients go through. And then I also heard of Leo Pharmaceuticals, a dermatology company, setting up a studio. So we were among the first, but we were not the first. We were certainly among the first. We probably were the first in India.
Yes,
but other companies have done this. Even companies like Novo Nordisk and other innovator companies, when they launch their new products, they've created starter packs, education for the patient, education for the doctor, nurse training, all of this using design thinking.
Yes, fantastic. And that was really one of the things that attracted me when I joined Studio 5B to leave the studio a year ago. Is this, this sort of understanding at the COE level of the importance of the process to help the organization to succeed and to help the products that we put in the market to relate and to be closer to our patients. I think that was really one of the things that attracted me to join Dr. Reddy's. So to continue a little bit what you're saying, right now Studio 5B is a studio that does design and innovation, and we have a lot of disciplines that we built in the last year, to enhance was already there before, around the design disciplines that are necessary to sort of help the business thrive within this domain of human-centric design. We got the discipline of research, qualitative research, and quantitative research. That is extremely important. We're going to talk a little bit more about this when we talk about the process later on. We got experienced designers around products, tangible products, online products, visual designers, UI designers, UX designers. We got brand and communications team with graphic designers, copywriter, and sort of brand strategies that does all things around brand identity, some work similar to what you did with IDEO, with this fantastic company. So this is a little bit about us and about how we're helping setting the design and the excellence of design within the organization. And more, we can during this 3 months explain to you how we do it and how we help the organization succeed when it comes to design. I think what people now probably are asking, for the ones who have never worked with the process before, they probably are asking, what is design thinking, right?
And yes. Maybe I can ask you a question on this. Yeah. Can you tell us the difference between design and design thinking? I know this, but I'd like the audience to understand the difference between designing something and following a design thinking process to generate insights and value-added products.
Absolutely. And design thinking is a process and an approach. I mean, you can call it approach, or it definitely has a process. You'll go through it later, but it's an approach, right? And it's an approach to design almost kind of anything. Like you can design products. You can design products that are online products, that are tangible products, that are consumable products. So it helps in the product development and product design. It helps in designing services. It helps in designing even things like architecture. So the design thinking comes from a school of design. So architects also use this design process. Designers use this design process. It also helps business innovate. So it's very, very close because of the nature of the process. Is very close with strategic thinking. So business innovation, it's business and product innovation, something that design thinking helps a lot. At the core of this design thinking process, there is the human-centric design, right? And this is what's really fundamental for us to understand. The process is highly driven by human centricity. And what does that mean? Is that we put the human, in our case for pharmaceutical, the patient, at the center, the patient, the partners, I mean, when you talk about service, at the center of the way we work and develop that product or develop that service or that consumer, right? And everything turns around it. Now, it can be applied by anyone, the process. It's not just limited to designers. Yes, designers studied it at school and applied in their daily life by the nature of what they do, but it's a process that can be learned, understood, and followed by anyone, from business to HR, to marketing, to manufacturing, anyone. Our PSRs could also think in this way, or we could think about how to design for them through human centricity. Now, design, it's actually the implementation, it's actually the representation of something that goes from idea, right, from an idea or a concept or a strategy into something that becomes tangible and becomes an outcome. That's the execution level. That's a different story. That requires a lot of experts. That requires cross-functional teams. This requires a heavy collaboration and project management holding to actually deliver something at the end, right? But there are two separate things. While a designer, for example, needs to have a 4 years degree in design school, needs to spend quite a huge amount of time in design studios, in agencies, or in-house teams to learn the craft and the excellence of craft of what they do in design. And it could be many things. It could be UI, it could be user experience, it could be product, it could be a spatial design, a graphic design. They are very specialized crafts that require that specialization. The design thinking, it's actually then a process that helps all of us, designers and anyone in an organization, to thrive in a human-centric design approach. I hope I answered your question.
So I mean, yes, and I also would like to go a little deeper into this. So design thinking is a process of understanding the person or the individuals or the group of individuals that you're designing for at a very deep level, creating a rapid prototype, testing the rapid prototype, getting their feedback, and iteratively improving the design. And this is how I look at design thinking as a process. Designing is actually doing the work of creating the service or the product and doing that. So designing is part of that prototype creation, testing, and doing that part. But design thinking is really a way of doing things, a way of approaching a solution for a problem or identifying a problem. So I've been very inspired by some of the design thinking projects in the world, and I've seen design thinking really flourish on the west coast of the US, where it was located and where all Silicon Valley is, and people put themselves in the shoes of the people experiencing the problem for which the solution is being found, and with deep empathy. And empathy is not sympathy, it is empathy is putting yourself into the shoe and understanding the problem from the perspective of the person that we are designing for, and also asking provocative questions. And I read about this, and I also went to IDEO studios, and the questions they ask is, how might we, for example, do something? This how might we is a phrase which I think is
Yeah.
common to the design thinking process.
Yes,
So,
absolutely.
yeah. So, I think the insights that you get through this design thinking process is really truly enriching and value adding when you're creating a service or a product or an interface or a solution.
So later on, I requested the team to flash the process journey, and I would love to go into detail or everything what you're saying, because this is really, really important what you're saying. The empathy is really the heart of design, in design thinking. We'll explain to everyone how we go, how we look at that process, and how can they implement it, at the high level right now, because that discussion is more detailed. And you've mentioned, the West Coast, and I kind of would love to pick up what you're saying, and I think it's a bit of a curiosity for everyone. Where does this design thinking, we are in the theme of telling what design thinking is, and where did it came from? When did it started? It's as old as almost 50 years old, actually more. So it started around the late 50s, okay? And this was really around the time the American president Eisenhower created the NASA, and funny enough, this thought of design thinking did not come from a design school. It came from an engineer at that time. They were setting up NASA, and the engineer was a professor, I kind of forgot his name. He proposed that design engineering should be human-centric, okay? And this was a very strange thought at that time. At that time, they were thinking about Cold War and sort of how to resolve hydrogen bombs, and I don't know. But, thinking about human-centric design was something completely new. And so they started in the 60s, the first ever product design discipline. The first school of product design started in the 60s in the West Coast, in America. And what then became what you referred to, that is the Stanford D School in 2004. This was actually the foundation of it. And it's a beautiful story, right? How it started from something completely technology and engineering driven to become something that was design driven, right? And it's a question we still have today many times when we talk about design together. But it started, that question started already in the 60s, and it's
just to build on what you said, you must have heard of this company called Braun in Germany, and they were one of the few early adopters of design thinking, and they had these 10 rules of design and how you design products, and that was also very inspiring to me. And I think Apple and Steve Jobs were inspired by some of those principles of purity of design. Again, that is design and not design thinking. But I think, talking about the West Coast, I'd like to narrate the story of 5B. Why is 5B the name of the studio? I think some of you know this history, but for the people who don't know, I want to narrate the inspiration behind naming the studio as Studio 5B. And it's very appropriate because we are now in a pandemic, and we are in a very similar situation in the early stages of the pandemic. Treatment was not possible and all of that. When AIDS started, really proliferating in the US, people were very scared about how it spreads. People did not fully understand how HIV virus transmits from one human being to the other. And the gay population was really a victim of this disease. And San Francisco, which is home to a large number of gay people, there were a lot of people who contracted AIDS, and they were dying, and nobody was giving them any succor. There was no treatment, and hospitals were not prepared to handle them, and they were not admitting them. They were not getting treatment. And that's when a few brave people created a ward. This is the ward 5B in San Francisco in one of the hospitals there, and offered at least nursing, admitting the patients, looking after them, caring for them, in spite of the risks that were perceived at that time. So we saw that there was a great deal of empathy for these people by this group of nurses who started this ward 5B, and the amount of courage they had to go against the scare caused by HIV/AIDS, and really gave relief to the population. Then, of course, the people's understanding of the disease grew, and then everybody started treating, and people got this. But this first act was by 5B, and there's a movie about this. Ward 5B, it is called. So Ward 5B was the inspiration for naming our design studio as Studio 5B. I was really touched by that story. And while this team was coming from San Francisco, they were taking a flight, and coincidentally, the gate they were taking the flight from was 5B. And they took a picture of that. Must be on your archives there.
Yeah, absolutely. It is a beautiful story, and I think, as you said very well, it's super relevant what's going on with us today with the COVID-19 situation, and how design studios and design thinking should, it will help us kind of connect in context, connect the things we create, the brands we develop, the products we put out there. That needs to be contextualized. There needs to have an empathy with the people we're designing for the people we're creating for, and it's a beautiful example. We halfway through our conversation, and I think today, the broad theme was how the design thinking transform organizations or forming organizations in a sense. How can you help innovate more? How can you help and make it more successful? So I'll hear from you. I obviously have my design on how I think of that, but I'd love to hear you as as the head of the organization. What do you think design can help us, innovate and thrive and
I want to tell the story about as these bubbles on our side. The two values behind the logo are empathy and dynamism. The signify empathy, the notion of empathy, and how you put yourself in the shoes of the patient to their needs. Empathy on the needs of the patient, and dynamism signifies speed, creativity, and agility to solve that problem that you identified through empathy. So in a way, our logo has this elements of design thinking built into it. So it combines empathy and dynamism. So the question that you asked me about how companies can benefit or transform themselves from using design thinking as a process. Firstly, I think design thinking is wonderful for really understanding the needs. I mean, and if you take, for example, an employee has a journey in a company. He or she joins the company, goes through the induction, goes through the training, gets deployed, does work, looks for growth in earnings and growth in knowledge and skills, and then has this journey through life and then goes through retirement. But if you design your policies and your the employee experience by putting yourself in the shoes of the employee, and really understand their deepest needs, their motivations, it gives you a whole different perspective than having policies which aim to control behaviors, predict behaviors, and ensure people comply. So from the aspect of from compliance, you go to inspiration. when you use design thinking, and it really unleashes the potential of the employee. Similarly, if you look at design thinking for your simple things like even apps on your phone, the best apps are the ones which are created using design thinking by understanding the journey of the customer who's using them. And today we have amazing solutions on your smartphones based on solving for problems of transport, problems of shopping, problems of a doctor consultation, various things by living the journey of the user. And you cannot jump into a solution easily without going through that process of understanding the full journey of the user. Design thinking helps that. So design thinking, if a company is able to adopt this, can create enriching experiences for its customers, and customers will want to come back again and again, understand the deepest needs of the patients, solve them in a very delightful way. Similarly, internal processes, internal policies, solutions, technology solutions, all of this can be much more superior if you use design thinking to identify the insights, design for the user, and iterate the solution till it reaches a level of delight for the user. So I think it's very hard to imagine an organization become very, very successful without doing these journey thinking, this design thinking. And you will see examples of that everywhere. And I was speaking, I and Archana met the CEO of DBS Bank. And there, every senior leader has to go through a journey, and he has to map the journey of the customer intimately and do that as a rule. So, I hope we can also adopt design thinking and make the experiences of our patients, partners, customers, employees delightful. And that itself will be a huge competitive advantage.
Yeah, I completely agree. I think this is exactly why we're here talking today about the importance of it and to make the organization successful. You say great things about delightful experience, about putting yourself in the shoes of a patient, putting yourself in the shoes of an employee, of a customer. Everything resonates with me from my design background and from the way we work here in the studio and we do at Dr. Reddy's. I kind of would sort of say what you say and summarizing maybe like in 2 or 3 things that I believe that helps transformation. One is the thinking, the way to think differently, to help business think differently, right? Is one of the things that I see is many times involved in a lot of conversations across different things we're working with Dr. Reddy's, how to help the business to think differently. And this is really about thinking beyond the obvious and thinking, beyond the lower hanging fruits and think a bit deeper or differently. There's a great example, and I'm sure you're familiar with this example. There was, that happened quite some time back. This guy, Rory Sutherland, was the vice chairman for Ogilvy and Matter, one of the biggest advertisement agencies in the world, and it still is. And this is a little bit the story about how he was asked to look into to create a soft drink that was a rival to position of Coca-Cola in the market, sort of a rival that would place himself, the soft drink, into a second popular drink of the market. Okay, now this is ironic story, but it's also fascinating to tell, because he went into a room with experienced businessmen and CEOs in the domain of of the soft drinks world, or not the drinks, and then the ask was really that, right? So let's create the second most popular drink in the world that rivals Coca-Cola. So the first thing that came to the mind in the room to the people in the room was, okay, so let's create something. Let's create a bigger bottle. Let's create something that is sweeter than Coca-Cola, and let's create something that is cheaper, right? So that was kind of the obvious approach to do something that will be successful. Nobody ever thought about, oh no, wait a minute, let's do a smaller bottle that tastes awful and it costs more expensive, right? But that's was exactly what happened. That's exactly what Rory did. So that's when Red Bull came to be. Red Bull was a smaller bottle. It would taste awful and was much more expensive than Coca-Cola, and it became in the market the second most drinkable non-alcoholic drink. So it's really interesting, how through a design thinking approach and through kind of pushing the thinking, you arrive to a solution that immediately doesn't look to be the solution that will be successful and valuable in the market, but it becomes the one. So this is I think it's a fantastic example around design and design thinking. Other things I think it's important when we look in transforming organizations is the role that design thinking needs to play in innovation and technology, right? So I mean, digitalization and technology is kind of the word of the moment in any organization, right? I mean, as we go digitalization and sort of a digital transformation process. And obviously, again, I'll put my head as designer and say, well, before machines, there were humans there, and the humans created the machines, right? And as long as we look into technology and into digitalization as a means to solve the problem of the patient, as a means to solve the problem of the youth, we're going to be successful, right? We're going to be able to create successful products, right? And there's tons of things out there in the market, already helping, like organs on chips and things like about bioprinting, 3D printing on materials that are organic, so we don't actually do testing in humans and human trials, etc. So there's fantastic things already on also automation in terms of making your delivery and manufacturing system more automated, so allows humans to concentrate on other functions of the business. So there are really interesting things out there, but ultimately I think what is interesting is for us to put this human I think I got disconnected. Can you see?
Yes, we lost you for a minute. Okay. You're talking about human-centric design.
So I mean, when we look, if we use the design thinking process and we go into design thinking afterwards in detail, for everyone to understand a bit more what we're talking about, because Prasad and I are familiar with it, but not everybody on on audience. But what I think is really, and I want to try to connect this with the values that you mentioned before. When you talked about the logo of Dr. Reddy's, when you talk about the values of the company, what it means for you, what it means for us. It's really at the technology level today. It's very important that we look at this in how we simplify complexity, right? So we look into technology and we look into all these complex systems that we live today. And I quote you, a saturation in the market of digital products. There's a saturation. It's overwhelming, right? And also complexity of the systems that we need to implement in our organization as well, and in the market, the things we put out there, that is really bringing to the simplicity of the human needs, right? And the human needs are simple. I mean, you mentioned them as well, Prasad. The human needs are basic, right? It's about having good health. It's about achieving living well. Living with health, living with the things that we need at the basic level. And I think that really relates a lot to what we do at Dr. Reddy's, that is creating affordable medicine, making sure, that is, that good health can wait and is, it's for everyone. So I think that's, when we put that mindset, and we start working that way, I think there is a mean for success in transforming the organization.
Absolutely. I think I have seen good design coming out of design thinking, and poorly designed thinking, poorly designed solutions because we didn't take the time to look at the user, keep the human being at the center of the design process. And there's a lot of potential in this way of work.
Yeah.
And this is, I mean, and I think the process is somewhat little different. As scientists and engineers, we are all trained to do thinking very rationally, logically, whereas design thinking, you start with inspiration. You start with the art of the possible. Ask really, provocative questions, and look at what can be made in a different way, and what can we do that can really make a major difference to the user or to the human being at the center of the design process. And it's all the more relevant for us because we have defined our strategy into this famous three corner triangle, whereas we are going to be focused on winning in the spaces that we chose, and we're going to be the most productive organization, and at the same time we will focus on patient-centric innovation. All the three aspects of this look can benefit from this process of design thinking, whether in terms of in the marketplace, how you reach out to your customers, reach out to your healthcare professionals, doctors, patients, and all of that, and make the whole relationship much more stronger. And the second part of how do you make yourself productive? You make yourself more productive by simplifying things, by making things as easy as possible for employees to do, and eliminating all the complexities that come in the way of being productive. And of course, designing for the patient and finding finding their unmet needs and solving for them, creating services on top of our products, which can help the patients in their journey from sickness to wellness. Yeah. So I do see a central role for design thinking in implementing a strategy.
And before we will put the process on the screen for everybody, and we'll talk about the process in detail. But before we jump into that, I think I would like to to adventure myself into call it really the human-centric design revolution right now. And why am I saying this? Is because, as you said before very well, let's say 20 years ago you had IDEO that started it, you had Apple, you had IBM, right? That really were focused on driving the design thinking process and approach. But there were just a few in a world of that was out there. Today, almost every product company talks about it. Every product company wants to make sure that it's empathetic towards the users, towards the patients or the customers, and so it became a revolution, right? It became a must-have in the organization to make it successful. And we'll have a few examples as we go along in this series of webinars of how it is successful at different levels of the organization and the way we work. But I think, yeah, it is as you say it's so important for the transformation of the organization and Dr. Reddy's as we move also towards the healthcare, towards the beyond the pill. And yeah, I really would love to call it the human-centric design revolution. Yes. So if we could probably put up the process slide, so we could discuss, Prasad, you and me could discuss a bit the process with the audience and explain to them how we do this at the quite high level. So if I would request, Ashka, if you could put it up. Okay, so this is the typical process of design thinking. And, a little bit of an introduction, and then I will let us debate a little bit on the experience that you have, Prasad. Yeah. This is where all the magic happens, right? During this process, this is the beauty of design thinking. It is a simple process. It looks linear, although it is not linear. It's an iterative, and I'll explain how does that happen. But basically, what this process is telling us is that every business problem or any problem is for us an opportunity in design, right? And to that, I pick up what you're saying at the beginning. When you talk about opportunities, we're talking about how made we's. The how made we's is a question that exists pretty much during the empathy and define stages of the work that we do when we use this process of design thinking. So how made we come up with a solution that helps a patient go through their health journey. So how made we different things. So it's really transforming. To kind of summarize it, it's kind of transferring and transforming a business ask or a problem into a tangible and profitable outcome. Okay, and this is kind of done through the needs of the patient and the user. And what we try and kind of to do is to guarantee that there is an adoption, there is an adherence, and there is a loyalty to that product, to that brand, or to that thing we put out there. Now, profitability, and I want to say this because profitability is a term that we use here, but it's also a term that is seen through the lens of design thinking a little bit different too. What we mean by profitable. Profitable can mean anything, or sort of not anything, many things. It can mean making more money, of course, making more, more lucrative for the business, but also can mean saving lives. It can mean an employee positive experience at work. It can mean having more patients using our service. That can mean what we call profitable, right? And the equation here of this process, as you look at it, it's really about passing this abstract idea of the problem, this business need, to the filter of human-centric design. So we pass it through that filter to actually make that product or that service successful and not failing in the market. Now, a lot of the times when we look at this, a lot of fears will kick in when we look at this process. I mean, the process looks long. Hold on, we will, we'll debate with the process entitles. But there's a lot of fears that kick in, right? And a lot of biases as well, when we work for, in our domains of expertise. So there are fears around, will anybody buy our product? Would anyone recognize our brand, recognize our service? There's fears around, will it emotionally connect? Will anyone be attached and would be a designer already putting out there in the market? And with those fears and sort of our expertise that sometimes biases as individuals in our domains, we run too quick into the solution, right?
Yeah.
We run too quick into the end. We want to put out there in the market. We want to make sure and we miss all of this, right? And we miss all of this process, this iterative process that we have in front of you here. And this process, just to summarize, there's a couple of things about that I just discussed, but those tools that we use and those methods, and they will be all available for you around the November months in this microsite we're building. But this process has at least 30 years of validation of methods and tools. So those tools that exist to run this process with your business unit or your teams, it's being validated again and again and proved to be successful in sort of the work we do. So I'll stop here. I don't know if you want to add anything, Prasad, into this that I said, and then we can talk about.
Yeah, I will add a little bit. You cannot intellectually learn this process. By looking at this, it looks very simple and all that. But when you actually do the field research, it's an entirely different game, and how you listen is very important. You have to listen very deeply. You have to understand and uncover the unmet needs of the user. You have to go beyond listening to what they are saying to actually observing what they are doing. And that process of empathizing is not as simple as it looks there when you say conduct research to better understand your users. Hides a lot of stuff behind it, and it requires patience, active listening, active observation, looking at the smallest nuances. I had an interesting experience in the early days uh, when we were doing design thinking for packaging. How do we package our products better and make them more user friendly, make them more, solve some really problems for the patient? And we actually visited patient homes, and we also had facilitators to help us do the observation. And I went and we visited a young lady's house who just had a baby recently, and the baby was suffering from diarrhea. And you could really see the concerns of the mother when the child is very young and medicine is not useful and it's not working or something. And then you learn a lot more about motherhood, and then you start thinking of it not as the problem of diarrhea, but the problem of motherhood and how you solve for that. And similarly, we had many other interesting interactions with pharmacies, with doctors, and with patients, and how packaging can make a difference to them to understand the medication they're taking, the dosing regimen, the frequency of usage, and the expiry date. Today, and we solved for this, and really, I think our packaging is really superior because of we understood the real needs of the patient to see the medicine and understand whether it is still valid or not. Today, if you take out a few tablets, you can't read anything of the expiry date or the batch number or when it was produced, all of those. So I think it is looking simple, but I think there's a lot behind each of these steps in this process. And the most important one is the first step, really, and the first two steps, really, to uncover the unmet needs and really to define what you're solving for, or making the statement of what are you designing for, what are you solving for. And sometimes you start with somewhere and end up somewhere else, and the problem definition itself changes.
Exactly.
So it is very important not to hurry the process and start solving and writing the solution out. And this is a conversation I have a lot with our IT function, that first let's start to understand what the unmet needs are, and then go through the process of design, and then use design to really make the experience delightful.
Yes, absolutely. I mean, I'm loving what you're saying, and it's exactly that. I mean, I remember picking up on the thing you say right at the beginning. I was, I think, 2 or 3 years back on a call as well, like this, in another organization with a lot of big leaders on a call, and I was explaining what the design thinking was and how important that was for us to succeed. And it was a technology company that I was working at that time. And someone on a call stopped me, 10 minutes down my presentation, said, okay, but looking at this process, and this is to your point of looking simple. Okay, so then design thinking is a mindset. I just need the mindset, and I can do it. And I had to stop for a moment to know how could I answer that, in the best possible way, to make understand that yes, you need the mindset. You need the mindset to kind of understand that this process is important. And I have experienced that in Dr. Reddy's. There is already quite a lot of people that I've worked with that has exactly this mindset, and that mindset is saying that I need to put the patient in a center, I need to put the employee in a center, I need to put my partner in a center, right? And when you think that way, then what do I need to put here? I need to put the process of design thinking for this to work. That's the mindset. That's not the process, right? The process is more complex, as you're saying very well, and the process need expertise, they need understanding, and need collaborative teams to actually deliver at every stage of that process. Right? And to what you said really well, the empathy stage, the number one stage, is the most important. is really the heart of it, right? That's why we always put a heart when we represent empathy, because it's putting yourself in the shoes of the person you're going to be designing or creating a solution for. So the business may have told you, this is our problem, right? So the problem could be, we're not making enough money in this particular product, right? So how do I know why I do not make money? I mean, I may have, a sales report, and I might have some things that show indication that, why I don't make so much money that month on that product, and you may have, external factors or internal market factors, but maybe there is a human level that made that product not to be so appealing anymore, or not to communicate so well to the patient. And that's where, we kick in with this process. Let's try to understand. That's all the first phase, to understand the context and understand what's really going on, with the people that we're designing or creating a solution for. We have tons of tools to go through this phase. We use a lot of qualitative research tools. Now, we in the studio, have very specialized teams doing that, but we also know that working with us in collaboration, many units like marketing teams or business teams could think about how to use research themselves sometimes, by just providing them the understanding of how to use them and how they could, have those tools and implement themselves, right? What is important to understand, that is a process, right? It's not just the mindset. It is the process that you need to follow. So if you cover the empathy and the define, and the define is really when you start, bringing that problem into a tangible thinking and say, okay, this is what we should start thinking about. This should be the strategy. How made we start right here when we're defining together. Now, this defining exercise, it's a very collaborative process. Most of the times, we have designers, we have business leaders, we have actual users or patients, if you can. It depends of the nature of the work we're doing. We may need to invite external people like doctors, like psychologists, like anthropologists. If you go into areas like rural areas, we're doing a big project now in the rural area. In UP, we're running an extensive qualitative research for the rural area in the north. This stage is really important to kind of bring all this expertise together and all the research we did in the empathy stage to know what are we designing for, what are we going ahead with before we jump into the ideation. So I mean,
this is the hardest part for many of us business executives who are moving at speed, agility, wanting to solve the problem, want to act. We have a bias for action. Whereas the first two steps of empathizing and defining requires patience, requires observational skills, requires the ability to see beyond what is being expressed. So this is a difficult part for many of us business executives. And once we can crack this, I think the design process becomes much richer. And the definition of the problem itself creates a lot of value.
Yeah. And I think that's sort of what we're trying to help. Like, 5B is trying now with this series of workshops, trying to bring that awareness and that sort of facilitate those platforms to actually, execute the process. And obviously, we here are always open to talk with everyone who wants to reach out for us to kind of help in understanding this process and putting into practice. When we get that sort of, as you said, rolling, the next stages are much simpler because they are responding to something that is already defined as something that's going to be successful, because it will meet the unmet needs of the people we're designing or creating a solution for. And that's the stages of ideation and prototyping. So that's the great stage. That's the stage where we all come together for a creative process, right? This is a very, very, very collaborative, creative process, and is a lovely process. We do that now during COVID-19, we're doing that extensively online. We're using a platform called Miro. A lot of the work that we have done in the past, 6 to 7 months has been the ideation process being done in collaboration on a software platform where everybody comes together using that tool and sort of ideating and thinking about new ideas and possible solutions around the problem statement. Pause that, what needs to be done many times is a quick prototype. And why? Because the next thing we need to do is to test, right? And this is extremely important. So as well, as much as important was the early stage of the empathy, is that we went to our room, like to our creative rooms, to our brainstorm rooms, to our conference room, we ideated, we prototyped some solution, we prototyped some packaging, we prototyped some experience beyond the pill, and then we cannot make sure that it's successful in the market until we test it. So we need to go now back to the users or to the patients to test it with that prototype, right? This is extremely important phase. When we get to that testing, many insights can come out of it. Many new sort of things that we didn't think about before when we are ideating will come out on this stage. And that's where this process becomes iterative. Because instead of jumping straight into implementation, we should come back to the prototyping and the design stage, that is the prototyping stage, to change a few things to make sure we incorporate the feedback of those patients or those users and then going to implement. So that's more or less how, and therefore this circle is going around and around again to make sure that one stage of the process feeds the other. I don't know if you're scaring people with the process. It may feel to people that is very long. We have experienced ourselves that we had research projects lasting maybe for a year, but right now in a studio we are doing research process that lasts a month, right? So it really depends of the nature of the project. It depends of the criticality of the business, speed to market and solutioning. But there is also, we have so many tools and so many methods and opportunity to work so collaboratively across Dr. Reddy's that by no means, this should look to anyone that, it's going to delay my final solution. It actually will help you find a solution, be better and be successful, and will help you to put this hat of design thinking, to create something that will eventually make a difference in the market.
Yeah.